Welcome back to Future Forward. I'm here with our resident expert, and last time you opened this incredible door to AI-powered blood tests, the idea that a simple blood draw could spot something like cancer.
Right, and often long before a person ever feels sick. The response we got was just overwhelming, but, one question kept popping up.
Let me guess. This sounds amazing, but how is it really different from the blood tests I already get?
That's the one, and it's the perfect question, because while both start with a needle and a vial, they represent two just completely different ways of thinking about medicine. So I thought, let's frame it as a showdown.
Ooh, I like a showdown. Okay, set the stage.
In one corner, the trusted champion for over 50 years, the traditional blood test. And in the other, the revolutionary new challenger, the AI-powered blood test. Let's start with round one, the core mission.
Okay, so what are they actually looking for?
A traditional test is a specialist. Your doctor has a very specific question like, what's the glucose level or what's the PSA count? The lab machine has one job.
Right.
Find and measure that one specific thing. It's been the bedrock of medicine for decades. It answers one question very well.
Okay, so the specialist. What about the AI test?
The AI test, it's like a generalist with like a supercomputer for a brain. It's not looking for just one thing. It's taking a panoramic snapshot of your blood, usually by looking at something called cell-free DNA or cfDNA.
And that's the tiny bits of DNA that all our cells shed when they die, healthy or not.
Exactly. And here's the key. DNA from a cancer cell, it just looks different. It might be fragmented in a messy, chaotic way, or have these weird chemical tags on it, like little flags. Now, one single fragment is meaningless.
Just noise in the system.
Pure noise. But the AI's job is to analyze millions of these fragments at once and find a hidden pattern, a faint, complex signature that's totally invisible to the human eye. So the old test looks for a known suspect.
And the AI test is looking for suspicious behavior.
I love that analogy. Okay, so that must bring us to round two.
It does, and this is where it gets profound. Accuracy and the false alarm problem.
False positives. Yeah, the anxiety from that is real.
It's huge. And a classic example is the PSA test. A high PSA can mean cancer, but it's more often something benign, an infection, just aging. This high rate of false alarms creates so much anxiety, and more importantly, it leads to the next step, the biopsy, the tissue biopsy. It's the gold standard, but it is not a small thing. It's invasive, there's risk, a stressful wait, all for what might be a false alarm. The same is true for prenatal screening, a false positive rate around 5%.
Wow, 1 in 20. So that's where the AI test really shines.
It truly does. It's built to cut through that noise. Take the DELFI test for lung cancer. It has a negative predictive value of 99.8%. In simple terms, if that test says you're clear, you can be exceptionally confident you're clear. That's amazing.
And for false positives?
New multi-cancer tests are showing false positive rates of less than 1%. That is a 5-fold reduction in false alarms. So far fewer people are sent down that scary, expensive path for no reason.
Okay, expensive is the key word. Let's talk about round three, time and money.
Right, so you'd think AI would take longer, but the total turnaround blood draw to result is about 7 to 10 days. Very competitive. But the real speed advantage is in the clinical journey. The AI test can help you bypass weeks, even months, of waiting for specialists and scans.
A direct path to an answer. But what about that sticker price? An AI test has to cost more than a basic $50 test, right?
It does, but that's looking at the wrong price tag. You have to look at the total cost of diagnosis. The old way, a cheap test leads to a cascade of expensive follow-ups, scans, specialist fees, a biopsy.
The whole picture. I get it.
Exactly. One Canadian analysis found using a liquid biopsy first could actually save their healthcare system over $3,000 per patient by avoiding that inefficient cascade. So yes, the test costs more, but the process becomes much less expensive.
That's fascinating, which I guess brings us to the final round and maybe the most important one, the patient experience.
It is. The traditional path can be an emotional gauntlet. The uncertainty, the fear of the biopsy, the agonizing wait. The AI-powered path is smoother. It starts with a simple blood draw. For most people, it delivers a highly reliable all clear.
Instant peace of mind.
Huge. And for the few with a positive result, it's a much stronger, more confident signal that yes, a follow-up is really needed. It aims to replace a world of maybe with the clarity of yes or no. Precisely. So, let's be clear, traditional tests are not obsolete. They are essential workhorses. But for the crucial challenge of early screening, especially for cancer, the AI-powered test is the undeniable future.
It's a total shift from reactive to proactive care.
It isn't just an improvement, it's a revolution, which leaves us with a big question. As we get better at seeing these early signals, how early is too early? What does it mean to know you have a tiny, slow-growing cancer that might never have harmed you?
Yeah, where is that line between life-saving information and life-altering anxiety? Something for all of us to think about.